Hi, welcome to Mama Zulu Health again. Today we are here to talk about poisoning. So many of you have been asking about how to prevent poisoning at home, and that is why we're going to discuss about it today. So what is poisoning, by the way? Poisoning is anything that when taken or when it gets to the body can cause the body harm, damage, or even death. So anytime that you suspect your baby has taken any form of poison, it could be an overdose of a medication. Maybe the baby has taken a whole bottle of medicine. It could be detergent in the house. It could be insecticide. Anything that is not supposed to be taken by the body in the way they have taken it. So it is always good that whenever you suspect any kind of poisoning, you should always take your baby to a medical practitioner rather than guessing what that is and trying to do remedies that you hear or practicing meds that are not even practical. Please always take your baby to a medical practitioner, let them get checked, let a qualified person tell you what is best for that child to take to remove the poison from the body. So today I'm going to tell you some of the ways that you can prevent poisoning at home in the most simple ways that you can actually do in any kind of a setting. So one of them is always making sure that whenever you are handling things like insecticide or things that can be harmful when inhaled or taken in, you're using PPEs, like protective equipments. That is like wearing gloves when you're handling things that can be harmful, wearing masks and gum boots, just to make sure that your body doesn't get into contact with that poison or that harmful thing. Number two is to always keep things out of reach of children, like if it's medication or is those insecticide, detergent, whatever it is that you have in your house that a baby can easily take and cause harm to themselves. So you can always keep them on the upper shelves in your house, be it the kitchen, and always making sure that you dispose anything before their expiry date. For example, if something is supposed to expire by December 2019, you should not have it by the end of that month. Make sure you dispose it and dispose it safely so that no one else can access it, and this will help your baby not ingest that. Number three, always make sure to keep things in their original containers. I'll give you an example. So you have this bottle of juice. Your juice is finished and you want to reuse the bottle, maybe to store a detergent or something. So the baby or someone else in the house may think that the juice is still remaining and take the juice accidentally. So always make sure you don't put detergents in other things like in juice bottles, so that no one confuses that for something else. If you really have to reuse that bottle, please make sure you remove that label that was showing juice and replace with a label that's showing detergent or whichever thing you want to replace it with. So that I can give you another example. Maybe this is a bottle of something, a medicine like paracetamol, and the paracetamol is finished and you want to put something else here, maybe an insecticide or something that you need to use in your house. Please make sure that maybe your househelp may think that it is paracetamol when there's an emergency and she needs to give paracetamol to relieve a fever or something, and they give something that was poisonous to your baby thinking it is not poisonous. So please make sure you remove the labels, or if avoidable, please don't replace. If the paracetamol is finished, throw away the paracetamol, buy whatever you wanted to buy in the original containers. Number four, always try to use something that is child lock in your house so that you avoid baby using something without supervision. For example, we have this bottle of a medication. So if the baby tries to open, you can see it goes round and round without opening. But if you try to open as an adult, you know that you have to press down, then rotate, and it will open. So that is how we mean when we say child lock. The baby will not be able to open unless you come and open it for them. And number 5, please avoid using jikos in your house when there is no enough ventilation. When the windows are closed, the doors are closed, you might have carbon monoxide poisoning, which can be very harmful to anyone in the house. Please avoid that. If you have to use a jiko inside the house, make sure it's well ventilated, the windows are open, the doors are open, and there is enough air circulation. So those are some of the ways you can use to prevent poisoning in your house. And I would encourage you as a parent, as a caregiver, or if you have children in your home, always consult a medical practitioner. You can call them if you have your own doctor, or you can take the child to the hospital or anyone to the hospital if you suspect any kind of poisoning. Don't try to guess. Don't try to do any remedies that you're not sure of. Please try to always consult your medical practitioner. Thank you so much. I would like to thank everyone who have been supporting Mama Zulu Health. I really appreciate you. But please, if you haven't subscribed to our group yet or our YouTube channel, kindly down here there's a subscription button. Please remember to hit the subscription button and the notification bell. Thank you so much. I really wish you all the best, and until we see you in the next video,